Hello, my name is India Foy, and I am the Managing Director for the Center for Disability Health and Wellness. Thank you for joining us today for the 6th Annual Disability Health Research Symposium. We hope that the presentations and discussions so far have been informative and inspiring, and that you're finding the symposium to be a valuable experience. It is my pleasure to now introduce someone whose insights and expertise will greatly enrich our dialogue. Our keynote speaker's work has inspired change and shaped conversation in profound ways. Ella Greene-Moton has an extensive background in public health advocacy, public health policy, community-based participatory research, and programming, with work spanning the past 40 years in the city of Flint and surrounding areas. In addition, specific efforts in public health ethics have focused on providing an awareness at the community level, developing and elevating the community voice, and advocating for community inclusiveness at the state and national levels. Her areas of expertise include facilitating community academic practice, partnership building, and sustainability, developing, managing, and elevating community-based projects and training programs for graduate students and community members, as well as middle and high school students partnering with community-based organizations, schools, and public health agencies. Ella joined the Flint Odyssey House Incorporated Health Awareness Center in 1995 and served as an assistant director from 1998 to 2005. She served from 2006 to 2019 as a community education coordinator and bridge at the Center for Public Health and Community Genomics at the School of Public Health at the University of Michigan, Ann Arbor. She currently serves as administrator for Community-Based Organization Partners Community Ethics Review Board and the executive consultant and co-chair of the Flint Genesee Partnership Health in Our Hands project. She also serves as an independent community academic consultant, working with other academic institutions nationally that are engaged in community-based participatory research with their local communities. On the state, regional, and national levels, Ella is a member of the Michigan Public Health Association Board of Directors and serves as the Michigan affiliate representative to the Governing Council of the American Public Health Association. She represents Michigan on the Great Lakes Public Health Coalition and serves as the regional representative for Region 5 on the Council of Affiliates. In addition, and along with 5 of her Michigan Public Health Association colleagues, Ella serves as a cohort 10 and 11 fellow of the Leadership Academy for the Public's Health Michigan Health Equity Team. Ms. Greene-Moton is also the immediate past president for the American Public Association. Without further ado, it is my honor to introduce Ms. Ella Greene-Moton.
Thank you, India. Good morning, everyone. I am Ella Greene-Moton, and I do serve as the administrator of the Community-Based Organization Partners Community Ethics Review Board and the immediate past president of the American Public Health Association. I'm honored to be here with you this morning, sharing and gaining insights on this huge topic of disability. And as I began to prepare for today's symposium, I began to realize just how big this topic is and just how many moving parts there are under this topical umbrella. And I had to start from an awareness space. So as I started the process, I had to get to know you as a center and understanding and appreciating the fact that your mission includes strategies for, your Yes, your mission includes strategies for addressing inequities in healthcare access, quality, and outcomes experienced by individuals with physical, sensory, and developmental disabilities across the lifespan. And the fact that your vision includes working in partnership with members of the disability community to ensure that all people, regardless of type and severity of disability, have full access to quality health care and to wellness activities personalized to their background, strengths, and needs. I had to do that for myself because I was not as familiar with the center, but realizing that we have a lot in common. Our missions cross and intersect. Next slide, please. This process made me realize that my knowledge and understanding of the disability community was pretty much non-existent. Even choosing a topic to center my presentation around was difficult, but I landed on bridging disability gaps, addressing disconnects between academic findings and lived experiences because of the things I have observed over the years as others have tried to navigate through this process. It became clear to me that much needed to be done on many levels and for many layers, things that could, and in many cases, do impact my personal quality of life from day to day, beginning with my personal understanding and appreciation of this topic, while connecting with the different pieces related to the challenges that I experience daily. Starting there at the personal level, I also had to realize that many of my grassroots community partners might be even less connected than I am. Next slide, please. I'm sorry, go back. I had you move too soon. I'm sorry. A community lens is a way of viewing an issue or situation through specific perspectives, experiences, priorities, and a particular community. It involves understanding how individual actions, when combined, can create collective impact, and how shared identity and narrative help shape many members of a community and help them see their world and their place in it. Using this lens helps to identify the unique needs, strengths, and challenges of a group to inform policy practice and research in a more specified and effective way. The Community-Based Organization Partners, or CBOP, is one of those collaborative spaces where meaningful work on the topic of disability is possible and is taking place, but I know that we can do more. CBOP is an umbrella organization comprised of CBOs, or community-based organizations, and faith organizations whose united task is to educate, train, research, and mobilize underrepresented, underserved, and under-resourced grassroots communities to achieve equity in health and social justice priorities. And the CBOP SERB, or Community Ethics Review Board, is able to provide guidance to researchers engaged in disabilities research, helping to ensure that the proposed work is beneficial to the proposed community and especially focusing on the aging community. Next slide, please. And so when I started to think about what we might know, I had to admit that academic findings provide data-driven insights, while lived experiences offer crucial context-specific perspectives on what it's like to navigate disability. And sometimes there's a disconnect there. We also had, we also know that disabilities conversations is much more complex than most of us would like it to be. I know that many of us, especially at the community level, have not done our due diligence to see and understand the bigger picture involving disability. And I believe today's symposium will help to open some of those doors for many of us. Next slide, please. So when we think about the actual disconnect, what do we mean? And I started by talking about the disability, bridging the disability gaps. What are those gaps? Well, when I think about disconnects, I'm thinking about clinical focus versus the daily experience, or the lack of disability representation in research. And I know for some of these things I'm preaching to the choir because many of you are doing this work, but many researchers are still getting to this point. And thirdly, the inaccessible language and formats. One huge problem is that there's a major level of silence involved with the foundational understanding of disability, sometimes not knowing what to say or how to feel, and its broad reach across so many possible entry points, and especially as it relates to research. Some of the misconceptions about disability are having a clear understanding of what disability is, including who is defining it, or disability meaning inability, or disability as a personal problem, or people with disabilities need my help, or all people with the same disability determination will have the same experience and characteristics, or just thinking in terms of some of the fears involved in the disconnect. Next slide, please. We also must understand that there are several types of fears, and these fears require recognizing the unique experiences of disabled individuals and fostering a more inclusive community. So when I think about bridging the disability gap, I think about thinking in terms of disability-led research. I think in terms of co-design and participatory models. Thinking in terms of accessible formats and intersectional lens. So we're talking about situations where the research is not being done in a vacuum, where researchers are able to reach out to members of the disability community and invite them to be part of the research. And especially in helping to design some of the work that might be shared back with the community. It's important that researchers understand that people want to be part of research that's being done in their communities. We have a saying, no research on us without us. That's a true statement. Next slide, please. So thinking in terms of how we might bridge the gap, I think first of all, we have to take the time to identify the gaps, to look at where those gaps might exist, whether it's in education, whether it's in healthcare, whether it's in housing, wherever the gaps are, we need to be able to identify the gaps and have a conversation with folk in those communities. And when we have those conversations, we start to build relationships and create partnerships. But now we're talking about researchers really understanding the lived experiences of the folk in the communities that you want to work in. Because from those lived experiences, you're offered a deep personal context. You get personal experiences that folk have lived through that can help advance your research. You're able to identify relevant priorities, not assumed priorities, but relevant priorities. You're able to highlight the strengths of those communities and not just focus on the negative end of what the community doesn't have. And you're able to work together to create a process that will allow you to implement programs and activities that will truly benefit the communities that you're working with and not just the research and the researcher. Next slide, please. We also have to include what's coming from the researcher side, the strategies, the tactics, the know-how that the researcher brings. When that's combined with the lived experience, which is going to help develop the academic findings, then we're able to provide broad data from those experiences. We're able to establish evidence, trustworthy evidence. We're able to identify additional gaps that are not as visible as others. And we're able to build on limited context. You might know a little bit about that community, but there are many things that you don't know coming into the community. And putting yourself as a researcher in a space where you admit that connecting with members of the community that you want to work with is only going to enhance your research. Next slide, please. And so when we're able to pull these pieces together, when we're able to do our due diligence, when we're able to admit what we don't know and look for information that will help build our knowledge in these areas, I believe we're ready for a call to action. And that call to action would include centered, lived experience. It will result in the co-creation of solutions. It will result in we talk about empowerment and empowering spaces. I'm one of those folk who believe that you don't get to empower anybody. We together get to create empowering spaces. And that empowering space gives me the power, the strength, or the courage to take action in my community. Next slide, please. So it means that we need to reach out to each other. These two people are standing on what seems to me to be shaky ground, but they're bridging that gap. They've started the action that needs to take place. And sometimes that's what we have to do. We have to step out when it's not always a sure thing. It's not as solid as we would like it to be, but it's a space where we can start to build and create what needs to be in that gap. Next slide, please. I wanted to use these examples of references because many of you are researchers and you've read the articles, you've interacted with the researchers, but some of these pieces you might not have done. I'm sure you've done, you've, used information from CDC, but I don't know that you've actually connected with the disability section at the American Public Health Association, a group that's doing has done some exemplary work. And I really wanted to lift the first one on this list, the Flint Public Health Youth Academy. And I invite you to go to this Facebook um, or YouTube area to look at some of the work that they've done. But what I'd like to do before I close out is share a little bit of information about this group. Um, and it's important because sometimes when we think about disability, we have tunnel vision. We don't always think about it being an ageless piece that impacts babies through the oldest of us. So this group, and we call it FIRE, is an innovative pathway to careers concept in Flint. Yet the program domains within the FIRE are now new. The program is designed to engage and introduce urban youth into careers in public health, medicine, and research. The FIRE focus on early exposure, mentoring, role modeling, and interactive engagement, internships, summer camps, and youth-led projects. There are several modalities of FIRE ranging from a semester session, quarterly sessions, and summer camps. The FIRE consists of three domains. Number one, youth community assessment using the photo voice methodology. Number two, learning academy, a series of didactic interactive learning sessions. And number three, advocacy and training. And I wanted to lift this group up because I heard earlier that they actually have connected with the they've connected with the amputee coalition, limb loss, limb difference. And I was so impressed by what they've done here. These are young folk who, someone who works with the Amputee Coalition saw them at APHA and reached out to them and invited them to go to Chicago to talk to another group of young folk to bring them into a space similar to Fire Space. But also, this was their introduction to the disability community, but dealing with young folks. So we've got young people learning about disability, dealing with young folk living with disability. I have to shout out the founders of this youth organization, Dr. Kent Key, who is an associate professor at the Charles Stewart Mott Department of Public Health, College of Human Medicine, and Dr. Sarah Bailey, who is CEO of Bridges into the Future. I wanted to share that because, like I said, oftentimes we think we have tunnel vision and think disability is, just older folk, but it impacts all of us throughout the lifespan. And I invite you to reach out to them, to include them in some of your work, invite them into some of your spaces as far as disability is concerned. Um, and hopefully we can continue to grow this process. We need more exposure for our young folk. And I'm an example of us needing more exposure for older folk. I'm a senior citizen and I don't know what I need to know about disability because if I'm honest with myself, I have some disabilities. But oftentimes we don't like to say that. We don't own that. And it hurts us in the long run because we don't put ourselves in a position to take advantage of even the programs and services that are available. So, next slide, please. And I think, yes, it's just my contact information. So thank you so much for allowing me to share these few minutes with you. But more than that, thank you for the invitation, which prompted me to dig a little bit more deeply into the understanding of disability and how broad it is and how much how complex it is and how it's not just a single item issue. I thank you for that. I know for me, it's just a beginning. I'm looking forward to doing much, much more in this realm because I have a 92-year-old mother who could benefit from more than I've given in this area. So thank you again, and I look forward to your questions.
Thank you so much. This was really great to just have a discussion. I was really struck by, again, the importance of just talking about why it's so important to recognize that many of us who don't have a disability, we also need to understand that many of us will age into a disability. And that's why it's such an important topic to discuss and trying to figure out how we can not only share resources, tools, strategies that can not only affect those or help those, even with congenital disabilities, but many of those ideas are really translatable for older adults as well. So
Absolutely.
I know there are questions in the Q&A, so we can go through them. Do you prefer me to verbalize those questions and
Yes,
I can do
please.
that? Yeah, give me one
Yes.
second. So first one we have from it's actually how many disability organizations are part of the CBOP?
So, very good question. When I'm realizing how much we're not doing, I don't identify an organization within CBOP that's a disability organization, but I know some of the organizations that are connected with some organizations because we've had those conversations in our meetings. Our many of the members of CBOP are members of um, what is it? Mm, older Black elders. I'm getting that word wrong, but they talk a lot about the disabilities and the challenges that older folk experience, and especially African Americans in Flint, Michigan. So, but that's something that I'm definitely going to work on to really raise that bar just a little bit more because, like I said, many of us are seniors and many of us deal with issues, but we don't talk about it in terms of our disabilities. So that's something we've got to get over. That's something I've got to get over. I have some disabilities. Sometimes I can barely walk. It is what it is. So that's something I plan to work on.
Thank you so much.
Yeah.
The next question we have, are there any other groups like the FPHYA?
So there probably are, there might be, but I'm not aware of these groups. I know that um, Flint is seen as a very challenged place, but Flint is a very forward-thinking place because of our history. We have years and years of history working with some awesome academic and practice partners here in Flint. And it all, became evident when we had the water crisis followed by COVID. And we had to step up, we could say, we know how to do some of this stuff. We're not, that poor, pitiful little place people might have thought we were, but we were not. So there are other groups, but this particular group I know, because Dr. Key himself came to us, moving from um, oh God, what was he? He was at the, oh, I can't think of the name of the institution where he was, but he moved from um, one area, and when it comes to me, I'll shout it out, so you'll have to excuse me, to public health. He was not engaged in public health at all, nothing that dealt with public health. But when he came in, he actually brought some of the influences of engaging young folk. That's what we did. We knew the benefit of introducing different things to students in middle school, students in high school, exposing them to what they can expect in college. And um, so he had that in him. He probably brought some of that to our space as well, but he was well um, prepared to create this group. And so they might be in the process of helping other groups create groups similar to this. But I don't know, I personally don't know of any that currently exist.
Thank you so much. So I do have a question. I'll just add mine. So in terms of how to partner, obviously, this is part of the theme today is teaming together. And this is kind of like a beautiful picture of why we need all of us. And in terms of working better together. So I know you mentioned the water crisis. It did really spin off, and they were very inclusive, getting other individuals, including the deaf communities around Flint. So we have a deaf school up there.
Yes,
And that actually spun out several approaches to help with mental health needs, especially
yes,
for direct communication therapists that can actually engage that community. So one of the challenges that I think a lot of us have, whether we are clinicians, whether we are researchers, whether we are both or even part of the community, is how to better include the voices of everybody. Sometimes we're a little bit siloed.
yeah.
Sometimes we're trying to navigate and trying to make sure that they understand whatever group it is that we belong. I know we heard presentations earlier today talking about we don't want to dilute our focus on
Right.
certain groups by including people with disabilities. So I know this is sort of a rambling question, but how can all of us collectively work better?
So I think one way that we can do it, and it would be because not all of us will be working on the same thing. We all have different interests, and somebody mentioned, we have different missions and different visions. But I think one way that we can move all of our um, work forward would be if so taking a group like CBOP. If you communicate with the leadership of CBOP, what we've started to do, and actually started this years ago, create a process of knowing our members and knowing what they do, what their specialty is, what experience they have in certain areas. So if you're working on a certain piece that has to do with mental health, we would be able to say, organization XYZ is the organization that's connected with CBOP. That's the best organization to take the lead on that out of CBOP. So we would be able to help you connect with those organizations or those entities that would really, number one, have an interest, but have experience in some of the areas that you want to work with. And I think that actually helps to save time, and it's a win-win for both.
Thank you so much. Yeah, I think the facilitating the connections and networking, and I think all of us can really help and make it a win-win, as you mentioned. Okay, I do have one other question. So what did you learn in your role as a president of APHA about the gaps between academic, public health, healthcare systems, and community, and how we need to move forward? How do we ensure that people with disabilities are included in this path?
I think my role actually just helped to solidify what I already knew. Um, I I learned how important it is that all of that's taken into account. Um, I think my role as so it's a 3-year term, so serving as first as president-elect, there's certain responsibilities. As president, I had a responsibility of visiting up to, I think I did about 20 states last year for annual meetings. But it actually helped me to elevate my voice, but the voice of APHA, which is influenced by the voice that I brought to that space from my grassroots work and my partnership building, and the expertise that I already had, it allowed me to bring that into that space. And I have to just give a shout out for even that piece, because most people don't recognize that I am really the very first community facing president to serve in the role of president of the American Public Health Association. And we're talking about a 153-year history. And I like to take it a step further. This makes some people nervous. I'm not nervous about it because it's my reality. I'm actually the first non-degreed person to serve in that role. So, what it tells me is that we were doing something right. Somebody was watching, and somebody valued what we brought to this space. And I'm just honored to be one of the folk helping to move it along. We have very strong community partners all over this country. And the crazy thing that many of us connect as a result of APHA, or the American Public Health Association, and the units, the caucuses, the sections, and the affiliates that are connected. So we are basically sharing the same message and helping to build the same, we're building on the same end results.
Incredible. And again, this just goes back to that we need to value all of our partners, including people in the communities. And I learned so much from them. So this is great. I am going to just double check and see if we have other questions here. And I have another one here. Is there a good website or source for an average person to keep up on public health policy in the state of Michigan?
Oh, wow. That's a good question. I would love to say the Michigan Public Health Association, but I think I remember in our last meeting them saying that they needed to work on that. So that will be an area. Gosh, I can't think of a website, but I would say check on the policies. So APHA would do policies of, for all states. So you'd be able to find something there.
Thank you so much.
Yeah.
Okay, I don't have any questions in the Q&A at this time. Any other pearls of wisdom or anything you would like to close with before we transition to the award part?
I would just like to encourage you, and Dr. Mead, you guys just continue to do what you're doing. I am committing to getting more involved with what you're doing. I'll be honest and say I'm one of those folk. I love boards. So if you're looking for advisory board members, throw my hat in the ring, and I would love to be considered. But I'm interested in learning more because I know so many people that can benefit from the work that you're doing. And we just have to find a way to be able to utilize everything that's happening in this space and share it with the folk that need it. So I'm excited about that.
Thank you so much. We'll definitely be in touch. I know we have so much to learn, and really make this a win-win, as you mentioned, bi-directional. I think there's a lot that we can tackle on. So actually, I think I was reminded. I'm sorry, one more. Actually, let me see. Yeah, sorry, I have one more question. What are some initiatives we should support those in more rural areas? And I'm assuming it's not just the state of Michigan, but beyond.
In rural areas. Specific initiatives I can't give you the names of, but I know in working with some of the other states that are really doing rural work, um, it's actually figuring out how to provide that access to the members. It's like, they're literally disconnected from so many things. So figuring out, I think initially it would be figuring out what that rural community needs, because we can't assume that just because it's a rural community, it doesn't have access. Some of them do. So being intentional about understanding what the rural community that you're interested in or that you would be working with, have those conversations to understand what they need, rather than going to them telling them what they need. I think, and when you do that, they will open up and you will get to know and even it might be a situation where you build it together. What they need might not exist. So it might be something that you would be able to create for that rural community. But yeah, I would say find out what they need.
Thank you so much, Dr. Greene-Moton.